First, I want to thank my colleague from Rhode Island who just spoke. We did work together over the past few years in putting together this legislation. We did it, by the way, with the House of Representatives. So Senator Whitehouse and I took good ideas wherever we could find them, whatever part of the country it came from, including ideas from the House of Representatives. We didn't ask who had the idea. We asked whether it was a good idea. We kept this entirely nonpartisan, not just bipartisan, and therefore we built something that makes sense for our communities back home to deal with this epidemic of prescription drug and heroin addiction and overdoses. And I appreciate his partnership in this, and I appreciate the fact that he came to the floor today to talk about the importance of moving ahead with this legislation. After all, it is very rare around here to get a 94-1 vote on anything. And we did it on this bill because after 2.5 weeks on the floor of the Senate talking about this heroin and prescription drug epidemic, every single senator in here realized this is a problem in their states, and 94 senators stood up and agreed that this legislation will help address it. By the way, since we passed the Comprehensive Addiction and Recovery Act, or CARA as it's called, in the Senate on March 10th, 42 days have passed. That's more than a month. Every day we lose about 120 Americans to drug overdoses. That means in these 42 days, we have lost over 5,000 fellow American citizens to drug overdoses. Think about that. So I do urge the House to act and act quickly. These numbers keep getting higher and higher. This is not getting better. Back in Ohio, this is getting worse, and I assume the same is true in your state, if you're a senator here and if you're a member of the House of Representatives in your district. Since 2007, we have looked at these numbers, and drug overdoses have killed more Ohioans than car accidents. It's now the #1 cause of accidental death in Ohio. It has tripled from 1999 to 2010. We're now told, by the way, that 200,000 Ohioans are addicted to opioids. Opioids is prescription drugs and heroin. 200,000 Ohioans. That's the size of a significant city in any state represented here in this body or any district on the other side. In fact, it's the same size as the city of Akron, Ohio, where I was this week on Monday meeting with their opioid task force because they are alarmed at what's happening, and they want to be sure that we're making every possible effort we can on the prevention side, education side, to get more people into treatment, to get them into longer-term recovery, to provide the police officers and other first responders with the Narcan, this miracle drug they need to stop overdoses from turning into a death. They want our help. They support the CARA legislation. They need it, and they need it now. Cincinnati Enquirer had some really troubling news last week. They wrote a story about a new poll that's out. It's a group called Interact for Health. They do an annual Ohio Health Issues poll. They found that in the poll in 2014, 2 of every 10 Ohioans knew someone who was abusing prescription drugs. A year later, it's 3 in 10. So this is not getting better. This is getting worse. And by the way, this is just prescription drugs. By the way, of the 3 in 10 who knew somebody who was abusing prescription drugs, 4 in 10 knew somebody who had overdosed on those prescription drugs. So these percentages are increasing across the board. Every age group, every education level, every income level. There's no demographic, there's no zip code, there's no state, there's no city, there's no county that's safe from this epidemic. It is spreading, and it's spreading everywhere. This poll, again, is another indication we've got a lot of work to do. This should be a motivation for us. This should get us to pass this legislation. And yes, can we work on additional legislation? Of course we can and should. And I'm encouraged that the House is taking up new bills and looking at this in different ways. That's good. But we know here in the Senate and over in the House that this CARA legislation will help, and will help now. By the way, there are over 120 co-sponsors of the CARA legislation in the House, because not only did we work with them and introduce identical legislation in the House and the Senate, anticipating this day when we could pass it in one House, we wanted to be able to pass it quickly in the other House and get it to the President's desk for signature. There are over 120 co-sponsors over there. It's bipartisan. Think of the impact we could have on the community if we could get this passed. If we can turn around just one life, it matters. And we know that this can save many lives and make many people begin to look at this issue differently, that this is a disease. Addiction is a disease. It needs to be treated as such. Removing some of that stigma will bring a lot more people into treatment alone. And that's part of, to me, what's important about this legislation. There's another issue. It's not prescription drugs, and it's not heroin, but it's another issue related to it, and that's fentanyl. Fentanyl is being laced with heroin throughout the country. In Cleveland, Ohio, a couple of weeks ago, we lost 12 people in 6 days to overdoses. One city. And this was heroin, but it was laced with this even more dangerous, toxic substance called fentanyl, that, by the way, comes in the mail. The drug dealers are shipping it in the mail. It's so toxic, 10 to 30 to 40 times more toxic than heroin, that it's dangerous even to open up the mail. If you're an inspector, we're told, we had a hearing on this week. We talked to the Customs and Border Patrol people. Why can't we stop this stuff from coming in, was our question. This, unfortunately, is something that is also increasing. Ohio, they say, is one of the top states in the country in terms of fentanyl overdoses. But I will tell those who haven't dealt with this fentanyl issue yet, it creates even more issues because it is so deadly. After 3 years of work on this CARA legislation, Senator Whitehouse and I and others, including other senators on both sides of the aisle, we did hold 5 forums, as you said, on various aspects of this debate. We consulted with the experts in treatment and recovery, the experts who are focused on how do you keep kids and other people from making these bad decisions in the prevention education community. We met with the drug experts in the administration, such as the White House Office of National Drug Control Policy. We brought in people from all over the country, including from my home state of Ohio. This is the 3rd time that I've come to the floor. I've come once every week we've been in session since we passed it, to say to the House, let's move on CARA. Let's get it done. It will help immediately. The majority leader in the House has said that he wants the House to take on the drug epidemic and pass legislation soon. I believe him. He's a good man. I appreciate that. But I would ask him again to please work on the other legislation. That's fine. Take them through hearings and markups. But we cannot delay. We know CARA will work. We know it'll work now. It's sitting over there. It's ready for action. It could be taken to the floor immediately under suspension. It could be passed. We're one vote away from having this go to the president and then having it go to help in our communities. The chairman of the House Energy and Commerce Committee, Fred Upton, who's a good friend and a man with a big heart and cares about this issue, has said that he'd like the House to move quickly with, as he says, an all-hands-on-deck effort. Good for him. One of his subcommittees, the Health Subcommittee, recently marked up a dozen bills. This happened yesterday. 12 bills were marked up. Look at those bills. A number of them are actually part of CARA already. They're in CARA. They're smaller bills. None of them are comprehensive like CARA. And one reason we have to get CARA passed is this is a problem that has to be addressed from all angles, from all sectors. That's why it has to be comprehensive. But those 12 bills that were marked up yesterday, many of them are identical. Others are very similar to the CARA legislation. So this shouldn't slow us down. In fact, it's even more an indication that if these are the kinds of bills the House thinks are the right way to go, let's get CARA passed. And then we can work on the other legislative ideas that members may have. So I respect my colleagues, Chairman Upton, the majority leader over there, Chairman Pitts, who's the chairman of the subcommittee, also a guy who cares a lot about this issue. But let's give CARA a vote. 125 co-sponsors is the latest number I have as of this morning. The number keeps growing. It's bipartisan, it's bicameral, it's the right thing to do. Again, I know there are other ideas out there, and that's fine. We need to take those up as well. But let's go ahead and get this passed. Put it under suspension, take it to the floor, it will pass. We're one vote away from having this help our communities. CARA is not just comprehensive, it does the right thing in terms of focusing on what is evidence-based. In other words, we didn't just say, let's throw more money at this problem. We said, let's actually find out what's working and what's not working. I was in Dayton, Ohio at a group called Project CURE on Friday. I had the chance to visit with some of the administrators there, some of the recovery coaches, they call themselves, many of whom, by the way, are in recovery themselves. They're doing an amazing job. I talked to many of the patients who are there. They are people who are recovering addicts. Some have been clean for 2 weeks, some have been clean for 2 years. But I asked them the same question I ask all over our state. What works, what doesn't work? How did this happen? Most of them, by the way, told me the same story you hear time and time again. It started with prescription drugs. In fact, one story was from a man by the name of Anthony. He dropped out of high school at age 14. He got into drugs. He made some mistakes in his life, which he readily acknowledges. He ended up in prison. He said, 8 convictions, in and out of prison, in and out of the drug world. He decided to go straight. He made a decision. For him, a lot of it was faith-based, and a lot of it was being sure that he was going to be able to take care of his family, be able to be a contributing member of his community, so he gave back. Had a good job, had gotten married, was on the right track. He was on his way to work one day, and he got in a car accident. Now, for those experts who are listening to this today, you probably know what happened. I don't even have to tell you. But when he got in the car accident, he was injured. They sent him to the hospital. What did they give him at the hospital? Narcotic pain pills, Percocet, prescription drugs. Immediately, he became addicted again. He's now struggling, but he's back at the treatment center. He's getting his life back together again. But in the meantime, he's lost his family because the drugs became everything. He's lost his job because the drugs became everything. We talk a lot about the overdoses, and it's horrible. And it's 120 Americans a day. We don't talk enough about those who aren't overdosing, but who have lost their ability to achieve their own God-given purpose in life because the drugs are everything. So they have lost their families, torn apart. They have lost their job. They have lost their ability to be contributing members of our society, and those people who get into treatment and longer-term recovery, like Anthony is doing, they can turn their lives around. There is hope. It can work. Anthony's back for a second chance. Having talked to him, I believe he's not just on the right track, but that he will work through this. But this legislation is needed to help him. When I do meet with recovering addicts, I ask them to look at the legislation, look at the summaries, and tell me what they think. And what they tell me is they like it because they're convinced that it will help others to be able to have the access to treatment that they have. Probably only 1 out of 10 of those people who are addicted are getting treatment. That's the best number that I have. Maybe it's a little higher than that in your state or your congressional district. But this is an issue where if we provide more resources for treatment and begin to remove that stigma around treatment and get more people into a system where they can begin to get their lives back together with treatment we know that works. Our legislation supports veterans task forces and veterans courts because we know that this will help with our veterans who are coming back with PTSD, 20% of whom have this addiction. People say it's self-medicating. They have self-medicated to the point they're now addicts. We need to get them not in a prison cell, but into a treatment program. That's what these veteran courts do. And they surround these veterans with other veterans. They do an awesome job. I've been to them in Ohio. You have them probably in your state. If you don't, this legislation will help because it creates more veterans courts. We've talked on the floor before about the fact that there's been a huge increase, 750% increase in the state of Ohio in babies born with addiction. That's just in the last 12 years in Ohio. Go to any neonatal unit in your state or your congressional district, you will see these babies. They are being lovingly cared for by doctors and nurses. They are taking these addicted babies you could hold in the palm of your hand, and they're taking them literally through withdrawal. They have to, because these babies are addicted and showing the symptoms that you might see in an adult of addiction. We don't know what the long-term consequences are. We're having a hearing on this tomorrow in Cleveland, Ohio, at one of our great hospitals, University Hospital. Rainbow Children's there is one of the best children's hospitals in the country. Their neonatal unit is doing awesome work. I've been there, I've seen it. We're going to talk to the experts about this, how we can do even better to help these babies. But wouldn't it be great if we didn't have so many babies born with addiction, because the mothers, knowing of the consequences, dealt with their addiction problem to avoid it through prevention education efforts. Wouldn't it be great if we didn't have this 750% increase in children whose futures are uncertain because of being born with this addiction? Again, there is hope. I've been to a women's recovery center in Cleveland and Columbus and also in Eastern Ohio and Athens, Ohio, where I've met with women who are in long-term recovery with drug addiction. They're there with their kids. There is hope. We do have, with this legislation, the ability to give people more hope. Getting rid of that stigma, not judging people, is part of beating this epidemic, and CARA will do that by treating addiction like a disease. Madam President, there's an opportunity for us to move and move quickly to address this growing crisis we have in our states and in our communities, and that's to pass this CARA legislation. Is it all we should do? No. Of course, we should do more. And I know the House of Representatives will have some great ideas. I know there's some great ideas over here in this body. I know that the Help Committee is working on some additional ideas on how to get more medicines into this area of addiction, science, and treatment. They're working on ways to ensure that we can provide more help to people. That's great, and we should continue to work on that. But meanwhile, we know that this legislation will help. We know that if it's sitting on the desk in the House of Representatives, having passed here by a 94-to-1 vote, it's not going to help. But we know that if it can get off that desk and onto the floor for a vote, we're one vote away from getting it to our communities to begin to help, to keep people from making the wrong decision, but then if they get into a drug addiction, to help them to be able to turn their lives around and to achieve their potential in life, their God-given potential. That's what this argument's about. It's not about the fact that the Senate has all the answers. By the way, we wrote this legislation with the House. They were engaged from the start. We introduced identical bills. They have 125 co-sponsors. All we're saying is let's let this one piece of legislation go. Let's allow it to begin to help right away. And then let's continue to work on other ideas. Again, we've lost nearly 5,000 Americans to drug overdoses since the Senate passed CARA with a 94-to-1 vote. To begin to reverse this tide, this trend of addiction, of overdoses, we can and should act now. It's urgent. There's a crisis. There's no time to waste. Madam President, I yield back my time.